Welcome, everyone, to At the Table with CASA, presented by California Association for Health Services at Home, with support from Heffernan Insurance. Heffernan Insurance is proud to support home-based care providers across California, helping agencies protect what they've built and navigate today's increasingly complex healthcare environment. You can learn more at heffins.com, HEFFINS.com. My name is Mark Wilson, and every week on this podcast, we bring you real conversations about important policy issues and some practical strategies shaping home care across California, and always with some interesting people. So let's pull up a chair and get started, shall we? Joining me again for podcast number 2 is CASA's CEO, Sue Vang, CASA's Director of Policy, Advocacy, and Public Affairs, Tanya Batista, and the Director of Membership, Tricia Smith. Welcome back, everybody.
Good morning, Mark. Thanks, Mark.
Hi, Mark.
You know, it's funny. I was thinking as I was waiting here at the table, waiting for you guys to arrive, I was thinking about it being CASA's 60th anniversary. And I don't know, that got me to thinking a bit about, I'm probably the only person, in fact, I know I'm the only person that was on the face of the earth 60 years ago. I'm the oldest guy here. So I started thinking about what was home-based care like 60 years ago? And were they dealing with the same kind of things then that we're dealing with now?
Well, I think 60 years ago, just knowing from being in the industry so long, although I'm not 60 yet, I've been in healthcare more than half my life, and listening to people that had been around during that time, we had a lot of champions for the home-based care movement. They helped move our Medicare benefit forward for Medicare certified home health, which was, I think, started in 1965.
Yeah, but I did a little bit of research for 10 or 15 minutes on just home health. I didn't do hospice or private duty home care. Home health actually started in the late 1800s. Did you all know that? Before there was any Medicare.
Oh, yeah. No, it's been a movement since before Medicare, but I said 60 years ago is roughly when the Medicare benefits started for home health too.
Yeah, and that's according to the research. That's when home health care became a formal, reimbursable medical service. But before that, in the 80s, they just did it to help the poor and the immigrants and the underserved populations. And as far as the challenges are concerned, they were dealing with some of the same things then that we're dealing with now. There was, hold on here, too few trained nurses for an overwhelming need. So they didn't have staff back then either when it first got started. Nurses often worked alone, traveling long distances on foot.
Wow.
I mean, come on.
Imagine all the things that they would have to carry with them too.
Right?
On foot.
Yeah. So the challenges were huge. Yeah, one nurse, it says, might cover dozens of patients across neighborhoods, and burnout was a real thing. Care had to be delivered in crowded tenements, rural homes, and in unsanitary conditions. There was not we think about this kind of stuff now. You jump in a shower and take a hot shower. You couldn't do that back then.
No, the infection control techniques were probably not the same as they are now.
Yeah. So access to clean water was a problem, proper nutrition, of course, no modern equipment. So, kind of crazy to think about the challenges, the difference in challenges back then. And again, even 60 years ago. It would be really interesting to find the oldest living home care professional to join us at the table, wouldn't it?
That would be great.
Oh, yeah, absolutely. Well, and you think about too, Mark, from a policy standpoint, a lot of the reason why we bring in oversight agencies is not necessarily just from a funding standpoint and making sure there's access across the state, but it's also to ensure, integrity for all who are providing the services, meaning that, you talk about, again, fraud, waste, abuse. I mean, that's an issue that goes back all the way then as well. So that's something that, we continuously have to maintain, some understanding of and continuously be able to adapt to and update our systems to track and be aware of.
Yeah. Anyway, so let's throw out there, by the way, if you are the oldest living person in home-based care, or if you know the oldest living person in home-based care, drop us a note at info@casa.org, and we'd love to have you on as a guest. I'd love to go back and talk to some of the people that were working. I mean, how old would they be now? 80? Maybe go back 50 years? Yeah, 60 years ago, maybe you became part of home-based
20 years ago or 25 years ago when I started in home health, and hospice, we had staff that worked for us that were nurses back then. We
Oh.
had nurses in their 70s 25 years ago, still working for us, still
Mm.
going out doing home visits, and they would tell stories of how their work evolved over the years. Some of it, based on the technology and all of that and the documentation requirements and that type of thing versus very similar stories of, going into homes and taking care of people and all of that. And I think they talked fondly about it because they felt like they were always the person that was there no matter what the environment was they were going into was someone of respect, that they were going in there to take care of a loved one or a family member, and regardless of that environment, because I had nurses tell me stories of in various service areas where they were in gang territories and places like that where they'd go in and take care of folks, and there was, they never felt unsafe. They always were able to go in and take care of the person that they were to take care of. And I think just listening to the pride and the fact that these are warriors, these nurses that were going out there and taking care of people regardless of where they were going, did it with a sense of purpose and pride, and that's something I don't think has changed.
Yeah, and I imagine they're probably the original advocates for the home and community-based services where, they were able to see and then turn around and advocate for that these individuals could thrive with these services in their homes, in their communities, and they didn't need to go to skilled nursing. They didn't need to go into RCFEs, adult residential facilities as, the immediate settings, right? I mean, and that was the transition that we've been trying to maintain over these decades is that home and community-based settings not only create savings to the states and our resources, but it really is the preferred setting and approach for all to thrive, and it creates longevity. I mean, there's so much studies available to us at this point, right? To qualify why this is the preferred approach for older adults and those with disabilities. I mean, when we go back to those who were at the frontier, I guess you could almost say in some ways, but they were the ones who are also advocating for this and really proving why this is what we need
Do-
throughout the state and in our communities.
Doesn't it kind of speak to that idea, though, that healthcare early on was in the home? I mean, you didn't go to the doctor; the
Oh,
doctor
the
came to you.
doctor
Yeah.
did house calls.
And then healthcare became this thing where, well, we go to someplace, we go to a hospital, and it's just really interesting to me to see that evolution of, yes, it was in the home and then it was out of the home. People didn't really think about healthcare being in home, and now we're returning to that. And I think with things like, as far as I'm concerned, like telehealth, I just had not too long ago. The first time I've ever done this, and again, I'm an old man, so give me a break. But rather than going to the doctor or going to a the quick stop places, I ended up doing a telehealth appointment because I had a sore throat and got on with I think it was a physician. I don't know. I didn't really ask, but they asked me to take a picture of my throat, which I did on my iPhone. I uploaded it, and they said, "Yeah, you got the problem here. We write a prescription, and you can pick it up this afternoon at CVS, and have a good day." And it was done.
Yeah.
Mm.
I mean, I think
Yeah.
that's a good point. Telemed is something that has become so essential and important to what we do because a lot of the areas that we have are lacking providers and access to care. I mean, I have a family member that was just got new insurance and a brand new physician and was excited to go to the doctor, and they couldn't get in for 9 months.
Oh,
And so it's like, and that is something that, is a reality for people. And if we didn't have some of those other means to be able to get access to care to at least get like the referral process started, then, a lot of people would be in bad situations or forced to use, emergency rooms when they're not necessarily necessary.
right.
One of the things that makes me think about is workforce. We know that workforce has been an ongoing issue, but can you imagine 60 years ago when family members were the main workforce and they were the main support? And if
Right.
you either didn't have very many family members or you didn't have family members of age that could take care of you, what that strain would look like. And then also even education. Now you have family members who take care of you, or like you said, Mark, you could use technology to look up what does this mean? Or you could look up, how do I take care of this? I mean, you Google everything and you look and see how you could do certain things. But back then, when technology didn't exist, how do you, get training? There's no formal training. And so
Well,
those
and
are the
I think
things I think do.
that's where the nurses came in and they would train family members. And it's similar to the model we have today is making sure that we train the family members appropriately, that they have adequate caregiving there. All of that plays into that. But yeah, it was the nurses that would show a husband or a wife or an adult child how to take care or do a dressing change or those types of things.
Yeah, and they're already exhausted, so it's like they're already spread very thin, and you're like, "Well, I
Yeah.
gotta wait for the nurse to come in to show me how to do it, or I gotta wait till the nurse comes and does that." So, it's not as accessible as it is today.
So I wonder if I could throw something else at the three of you for just a quick conversation. I was having a discussion with a friend of mine who's coming back to home care after taking a little bit of time off. And he and I were talking the other night just about the state of home-based care. And he was talking about he's just getting into now looking at the numbers and looking at the operation and so on and so forth. And the discussion kind of turned to what I have heard from operators over the last couple of years myself. And it's the question, can you still build with all the barriers that are out there? Can you still build a sustainable home-based care business here in California? Is the math still mathing? You've got reimbursement that hasn't kept up. You've got labor costs that, are what they are, and you add regulation, compliance, and rising expectations, and all those things. I mean, what do you think? I'm sure you're going to say yes, it's possible, but that's the question I want to throw at you.
Well, I mean, I have a different perspective probably because of where I came from and the challenges that we faced. But knowing that it had been an uphill battle for a long time.
Tricia, you were a provider. You ran
Yes.
home health hospice.
And we did Medicare certified and hospice. A long time ago we did home care, but we focused more on the Medicare certified and hospice arena. And we had evolved over time based on the areas that we were at because in certain areas we couldn't. And then we focused more on the areas where we could. And just it never fails. It feels like there's always more and more they put on that is required and less resources available. And I think the staffing issue became probably one of the most critical issues for us, being able to have enough people to take care of the people that needed care. And I think that's where people get worried about competitors. And my philosophy always was is there's enough demand out there for all of us. The problem is there's not enough people or staff to take care of that demand. That was in looking at stuff since 2019, that demand has gotten worse and COVID pushed it over the hill. So for like the next 15 years plus years, it was going to be an uphill battle. That said, I think that in certain markets it's different. I think that every market has a different uniqueness about it that makes it something that is achievable or more difficult. It doesn't come without my feeling is I don't know why someone would want to get in this business unless they're passionate about it because it's not easy. It is hard work. It is not something that's going to produce huge profit margins. It is something that is sustainable and you can make a decent business to be passionate about it. You've got to care about what you're doing.
Hey, to Trisha's point, I feel like there's this huge misconception though, that if there's a demand, then you can't fail. And that's absolutely not true. Because having the demand doesn't necessarily mean that you're going to be able to have a sustainable business, right? So we talk about the workforce shortage. So without workforce, without compliance and payer strategy, I feel like your organization is going to stall fast. And so in this environment, access to patients is so much easier than access to staff. And I'm going to go back and say, yes, I absolutely think it is possible to go into the home care business now. It's significantly different than it was 20 years ago. It's harder, more complex, and it's heavily regulated than it has ever been before. So one of the things you need to do when you are looking into opening a home care, home health, or hospice agency is not only you shouldn't just look at demand. You really need to do your homework. You really need to make sure you're educated and you get the training and the background knowledge on what all the requirements are before you jump into it. because having a demand doesn't necessarily equal having a successful business.
Well, and something that CASA offers too is that we do regular analysis, especially through our policy committees. We are looking at, the market, what the margins are, and how these are impacted by, for example, the new rules that come out. I mean, CMS just issued yesterday their release of the hospice wage index and their rate updates. And that's something that we bring to the table. We look at how that's going to impact our California providers, which obviously in California, that's going to have a unique impact compared to the rest of the nation. And then we identify like what does our work need to look like from an advocacy standpoint? What is that education component? How does that translate to workforce? And then what can we bring to our state agency and oversight partners to ensure that we are progressing in a meaningful way so our margins don't continue to tighten in a way that these services, these home and community-based services, no longer exist. Because we do know the state agencies that they want to invest and make sure that our providers still exist, right? That they want these services to continue to contract with hospitals, continue to contract with MCPs so that, the public can access these opportunities. So, because hospice, you think about it, for example, I mean, this is something they want their loved ones to have at the end of their life, right? And similarly, when someone goes through a major life change and they need home care services, I mean, it should be there for them. And there's no doubt that we have a universal understanding of that. So how do we partner effectively across, the agencies and in the policy world, right? But that's where CASA gets involved. That's where we have our policy committees. We talk about this, we analyze it, and we take action. And so we have like our lobby day coming up. We're scheduling several appointments across the Senate and the Assembly, and this is the kind of discussions we're going to have. We're going to make sure that this level of awareness is always fresh. And each and every year, we're having these conversations not just on lobby day, but throughout the year, right? Because we want these businesses to, these business opportunities to be always viable.
I think and that's one thing, Tanya, there is opportunity. I mean, as much as I don't want to sound like a Debbie Downer, probably because I had lived that life. And quite honestly, the level of stress and hard work that's there, I can't discount that at all. I mean, it is there, but there's a lot of opportunity depending on how innovative and flexible that you can be. I think making sure that you stay compliant and look at everything that's impacting you across the
Mhm.
board, and being proactive. But there's a lot of things that, with these struggles like workforce that present on the other side opportunity. So those if someone has the innovation and way of thinking of how they can solve that problem, there's a huge amount of opportunity there because I
Oh,
think
yeah.
that care at the home site, wherever someone may live, is the future of healthcare. So I think that if folks are innovative enough, can think about what resources are out there, including CASA. I have to say we signed up our first startup agency yesterday, and basically what we're offering them is being part of their journey and moving up to a sustainable organization. And we're excited to be a part of that. From Tanya's help on the policy side and regulation questions, application questions, all of that, to our ability to support them with an affiliate membership that can help them with legal, accounting, all the back office services, billing, whatever they may need. And our education department is golden. I mean, I think helping them become certified, compliant operators is something that's going to position them for success. So I think from that standpoint, being open to the resources that are available, proactive, and trying to be innovative in a way, I think that there's definitely opportunity there. You got to have the passion. You got to have the want to be able to
Mhm.
take care of the people, the why you're in this business. Because if it's just for margins, I don't think that's a long-term success standpoint. And for our industry, we want people, I think, that are really focused on the outcome of taking care of our people in our community.
Sorry, I was just going to say I see CASA as the organization that supports all of the providers and very similar to when we talk about 60 years years ago when the nurses were the ones that the families needed and depended on in order for them to give the care that their loved ones deserve. Well, I see CASA as playing that role now, is that you have to be part of an organization, if not CASA, another organization that is going to give you those things. Because when we think about new providers entering the space, what they underestimate a lot of the times is the compliance exposure, cash flow timing, and then the staffing instability. And all of that, I think what we're seeing is that more and more people are entering the space, but we're also seeing a lot of organizations that are not able to sustain it. So you need to have that support system and you need to be a part of an organization.
So it sounds like you're saying that the need is always going to be there and it continues to grow, but you better really understand what you're doing. And an organization like CASA is not to make it a commercial. That's not what I'm trying to do, but you need that kind of support and education more than anything.
Yeah, yeah. I think we just ensure that, it's eyes wide open, but we also keep the passion and we provide the support, just like Trisha is saying. And I also think that the three of us really model that as well. I mean, not only does Trisha have her background and I have my policy background, but we also come from the experience of also having a passion in this industry and wanting to do good for our communities as well. And I think that brings an important aspect to, bringing success to CASA and our members.
I mean, people want to be taken care of at home. They want to be at home. And I
Yeah.
am so passionate about our industry and being able to support our industry now in a different way. I think it's essential. So we better succeed. Our providers better succeed. We have to have the service there. Not to
Well,
say that it's not going to change and evolve and they have to be prepared for that, but it's essential.
well, why does it feel, and I've been to many CASA conferences, and I always leave with the feeling that we're always kind of, I don't know how else to say it, but this way, like begging for crumbs. It's the home care part of the healthcare continuum that's always like, hey, hello.
Well, I think it's the most important. I also, from a historical standpoint, home care, the home-based care industry is like 3% of the total healthcare dollar spent. So if you
Mhm.
look at that from a size, from a voice standpoint, our voice, one thing that we haven't done a good job of is coming together as one voice and having a large impact. And from a advocacy standpoint, I think that's always been a weakness across the country in our ability to have a larger voice. It doesn't mean that the services aren't needed, but it means that the other industries, hospital association, other sectors have a larger voice, and that means dollars behind them. In advocacy, that's unfortunately that's what it means is the interest there. We have done a good job grassroots wise, over the years, but from a political action standpoint, we've not succeeded as an industry across the country.
So would it be fair to say that the more CASA can grow, the more membership you have, the more voices you have in that collective group, the better off everybody is in home-based care?
I mean, we've made
Yeah,
really good
The
strides.
more
I'm not
influence
trying to
we make.
negate, but I think that we can do a better job if we have more voices as one. I mean, if we all come together, all aspects of the home-based care sector, we have a more chance of having more weight thrown around if we have more members coming together as one.
Yeah,
I
and especially when you look at it through the lens of what California has to offer. I mean, we have rural, we have, the demographic variation, right? So when our members model that and we bring it to the national level, especially, I mean, it's just incredibly valuable and the strength behind that is huge. So there's so much that we can impact from that perspective. And like Trisha's saying, what can we demonstrate when it comes to the home care industry and that balance and that demand, against the skilled nursing, the hospitals, and balancing the funds therein when we talk about what are the needs for Medi-Cal, Medicare recipients. Because how can we match the demand, especially from our federal, CMS mandates of what they call balancing home and community based with what is it called? The the settings, the more restricted settings, but then they're not balancing it with the funding, right? So that's the kind of advocacy that we have to do.
And even though
And
we're
to
only 3% of that spend, it means also that we're less expensive and we produce better results.
100%.
Hold on one second. Okay, before we go today, let's talk about the new initiative, 60 new members in 60 days. It's pretty exciting stuff. And everybody is very festive at CASA because it is the 60th anniversary. So it's all about being 60.
Well, we launched our
Oh,
campaign on Wednesday for our 60 new members in 60 days. And we're recruiting our 5th anniversary class of new members in an attempt to ramp up for our 60th anniversary conference and expo. And so we're treating this more of a movement rather than just joining as a member. With this new movement, we are improving all of the services and values that we're providing to our membership. We're engaging our existing membership to be part of this movement too. And we're looking forward to seeing us grow with our membership and get to that larger voice that we talked about previously.
yeah. And I was just going to add that as we celebrate our 60 years, if you are too busy and you can't attend any of the CASA events and you can only choose one, this would be it. You don't want to miss the annual conference. It's the one time that you could take 4 days away from work and be able to get all the education, get all the continuing education that you need, but also help us celebrate 60 years, then, now, and next. We're honoring our legacy and shaping the future. And many of the education sessions are so innovative, but also we have a party that is going to be a blast. I mean, it's themed. You will be able to come in your favorite era. If you want to come in dressed in the 60s, great. If you want to come in today's, fashion, you can, or futuristic. So we welcome all that. That's why the theme is then, now, and next. And staff is definitely going to be there and we're going to be dressed up and there's going to be a dance floor and that's all you really need. So hope you guys can join us for this. That's 4 days, right? Don't think of it as work. You're learning, but you're also having fun.
Yeah, no,
Well,
that's
I
going
think
to
that's part of our values now too is fun, lift,
Yes.
leadership, innovation, fun, and teamwork. And so I think as Sue has said, we're putting the fun back into CASA at the conference.
And I think if we can work this out, that at the table we'll be there and have a present. So we look forward to sitting down with all kinds of people from all over California and just having a discussion and getting your thoughts down, for the show. So I want to thank everyone for joining us today and sharing their insight and perspective. Sue Vang, Tony Batista, Tricia Smith. And thanks to all of you for listening and for the work you do every day to care for patients and families across the state of California. If you'd like to drop us a note about a topic you'd like us to discuss or anything else you'd like to let us know, you can email us at info@casa.org. info@casa.org. And thank you to our presenting sponsor, Heffernan Insurance, for their leadership and support of California's home care community. I'm Mark Wilson, and this has been At the Table with CASA. And remember, this is your seat at the table. We'll see you next time.